coming to Lakeshore Vein and Aesthetics Clinic, what you should expect is a very comprehensive vein examination. We will take your medical history, look into your other health issues and risk factors for varicose veins, as well as a family history. We will do a comprehensive ultrasound examination, and that will be with one of our highly trained nurses. And then I will come in and verify the assessment, and we will make a treatment plan that is suited and tailored to your particular varicose veins. And it is something that we'll want to help you maintain, like pruning a tree, and we can go into that analogy more later on. We want to stay on top of this for you so that we keep your legs in the best shape that we can. So on the day of your treatment, whether it's a thermal ablation like laser or radiofrequency, or whether it's the glue, cyanoacrylate, Venaseal, you will come into the clinic and about half an hour to 45 minutes before your procedure, and then we'll bring you into your treatment room. A nurse will review your history quickly. You'll get changed into a gown for your treatment. We will give you Ativan if that's what you'd like for some anxiety, but you will need a ride home after that. The procedure itself, depending on how much work we have to do and how many legs we're doing, could be between 1 hour, 1.5 hours, sometimes 2 maybe. Especially the glue can take a bit longer sometimes if we're doing lots of segments. And then after that, you're put into your compression stockings, you go for a half an hour walk, and then you're free to go about your day. Restrictions would be really heavy weightlifting right after, and we don't want you doing any like really rigorous exercise. We want you to be active, so again, that half an hour walk right after and then daily. We do give you a prescription for a topical anti-inflammatory, and then you rub that along the treated veins 4 times a day for 2 weeks. And we also have you wear your compression stockings. That's going to help with comfort. And then if we need to, if we've looked into your risk factors and you need to take a blood thinner, you might be taking a low dose blood thinner for a week after the procedure as well. As far as your follow-up goes, depending on how many legs you've had done, you're either going to have 5 follow-up appointments if you've had both legs treated, or 2 if you've had just 1 leg treated. And you can use the next year, the next 365 days to use those. But at those follow-ups, we're going to check you with the ultrasound and just keep pruning that tree. So we will have come down to your much smaller veins by the end of your follow-ups, and those will be largely with our nurses. But again, if they find anything that they need the ultrasound for, I will be called in to do that. And then after that, we just want to make sure that we see you regularly, so every year or so, and we ultrasound you every year or so. And then if anything is starting, we catch it early when it's small, and then nothing will be able to grow into anything big that needs the laser, the glue, or radiofrequency again.